Hello, this is another video. My name is Jerzy. You can call me George, but in Polish, my name is Jerzy. So, or you could be call me George. How you decide. So I decided to put this video, another video that has to do with one's mental health and the way the medicine approaches and treats patients under systematic diagnosis criteria. So the most common way to treat someone is get the patient uh, get the patient to the doctor's office and give him massive quantities of neuroleptics and then send him home and hope that everything is okay in absolutes. But no, uh, newer approaches are moving towards changing the set and setting of a patient that has any kind of illness. It could be bipolar disorder, it could be schizophrenia, and it could be anything. And when you synchronize between low doses of neuroleptics and putting the patient in a certain setting that is hospitable to his mind and body, he will over time not necessarily need high, massive, big quantities of neuroleptics because these neuroleptics over the years you will build tolerance to them. You will adapt to them in a way that you will build tolerance. And if you do not change the set and setting, or you do not avoid triggers that are imminently harmful to the patient, will actually cause more consequential uh, things in the future of this patient. So it's important to take into consideration social support, uh, regulating intake of neuroleptics, not giving it until it is necessary for a patient. Do not give neuroleptics to people that without taking in consideration other things such as triggers and setting. When you give someone neuroleptic, it's supposed to be regarded as a tool. If you take something if you eat something, it is chemically affecting your brain. If you eat something or eat a dinner or evening with a person, you will eat it over a longer duration of time, which means while you're talking to a friend, you will as well chew the food longer because you will, when you talk to your friend and eat during this time, you will feel your emotions, your relationship with friends and families, and you will as well not eat out of emotions because I tend to see myself and others eat food faster when they're in comfort of their own homes and when they're alone. But when you eat with someone else and you have a conversation, meanwhile, you will chew the food slower. Your digestive system will break down the chewed food way more effective, and when your gut works better, there's direct connection and influence over your psyche, your mental resilience, your cognition, and as well your overall health. Because when the when your state of mind and resilience are synchronized with your neurological and stuff, and your physical stance, like how do you feel physically, how 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 relieved are your muscles and stuff, then when everything is synchronized in collectively, you will feel better and you will have a better prognosis of whatever disease it is because psychological is dependent on your neurological pathways and so on. So I was happy to make another video for people to see. This is how I see this, and every person's approach is individualist. Most people do not need high doses of neuroleptics. Many people just need to synchronize their emotions with appropriate certain setting, and they have to go to explore new things in life, so they do not really regress, and instead they move towards productivity and the remission of anything there is, like. And I was happy to put up this video.